Pfizer has said that a third booster shot of their vaccine may be needed within 12 months. Our North America correspondent Greg Jennett joins us now from Washington. Greg, we're just learning about this. What do we know?
Well, I think it's been widely anticipated, Mads, that because of the nature of these mRNA vaccines, and Pfizer is one of these, that the advantages of them are that they can be adapted to variants as they emerge. And so plenty of people have said over the last year or so that it may be just like the flu vaccine, where it's necessary to get updates for variants as each year passes. Now, Albert Bourla is the chief executive of Pfizer, and it seems that he had some sort of function with the big drugstore chain CVS earlier this month. In fact, on the 1st of April, but his remarks have now gone public, and it's still a little speculative to be sure, but Mr. Bourla did entertain the possibility, saying that it was quote-unquote likely that further shots would be required. That's a third shot after you've had your first two for full coverage, and even leaving open the possibility that annual shots each and every year thereafter may be required as well. So that's his look into the future. How would that be administered in the US? Well, it looks as though the White House COVID response team and its medical advisors have already been turning their own minds about the logistics of all of this. So it's not just covering the 77 million Americans who are fully vaccinated already and double that number, or more than double that number, who've had one shot by now. The Biden administration's looking beyond that. What would we do if we had to have third doses? Well, David Kessler, one of the chief scientific advisors to that response team, says there is a possibility of this and that they are doing some initial planning about subsequent jabs, if necessary, for the Pfizer. And you would have to presume maybe Moderna as well. It is also mRNA in its nature, but we don't have anything from the Moderna company about its current thinking. Nevertheless, a bit of an insight from Pfizer about what happens once you get over that initial hurdle of mass vaccination. They're all trying to control a thing called breakthrough infections. There have been about 6,000 of them in the US. This is where people who've been vaccinated subsequently get COVID-19, and that's what they're trying to control.
We're still learning so much about this, aren't we? Greg Jennett, thank you very much for that.